Good afternoon, everyone. It's a pleasure for me to be with you this afternoon, and also a big welcome to Tracey Maconachie, who is the chair of Research Manitoba. And in addition, we have joining us via telephone Dr. Ryan Zarychanski, who is the Associate Professor, Department of Internal Medicine at the Max Rady College of Medicine, University of Manitoba. So good afternoon also to Tracey and Ryan. I've invited Tracey and Dr. Zarychanski to be part of today's important announcement, which is about helping us in our fight against COVID-19 in the province of Manitoba. And thank you for being here this afternoon as well. I want to say to all Manitobans, thank you for the compassion that you continue to show to your neighbors, to people you might not even know that well. And thank you for your efforts to help flatten the curve of COVID-19. We have said that our government's #1 priority during this unprecedented situation is to keep you and your loved ones and the people around you safe, and also to keep those safe who are serving all of us on the front lines. So we don't ever want to miss an opportunity to say thank you to our frontline healthcare workers who are showing up for work every single day, who are showing steadfastness and dedication to their profession and to the patients that they are serving. I assure you that our government is acting quickly and responsibly to increase our capacity in our healthcare system in order to prepare our resources for COVID-19. We're working behind the scenes. We are working with our incident command structure, with our provincial and rural leaders, our federal counterparts, and with Manitoba researchers and scientists. And that is what brings us here today. So today I am pleased to announce a new $5 million COVID-19 research fund through Research Manitoba. Aujourd'hui, j'ai le plaisir d'annoncer un nouveau COVID-19 fonds de recherche de $5 millions par l'entraînement de Research Manitoba. We are taking the lead from clinical and scientific researchers in this province, and along with Shared Health, the Winnipeg Regional Health Authority, we've identified several new research projects. We are committing more than $3.5 million to support a number of projects in clinical and applied research. These projects include $700,000 for Manitoba's first COVID-19 clinical trial for a drug to fight this virus. Right now, this drug, hydroxychloroquine, is used to treat rheumatology issues, including rheumatoid arthritis, osteoarthritis, and other inflammatory diseases. This trial will determine if this drug can safely also be used for treatment of COVID-19. An additional $500,000 will be invested in partnerships with industry and philanthropic groups supporting existing trials based in Manitoba and with sites across Canada and in 7 other countries across the globe. And $1 million will be invested in COVID-19 innovation projects, including looking at the development of diagnostic tools. The money that we're investing today is in addition to funding that our government has already made available for other research opportunities to fight this pandemic. And this includes developing a COVID-19 vaccine at the University of Manitoba, the development of a cost-effective diagnostic test for COVID-19 at the Canadian Science Centre for Human and Animal Health, and an investigation by the University of Manitoba on how logistical systems can adapt to a pandemic. Our government is thankful for the work of scientists and researchers in our province. Their work demonstrates that we're not in this fight alone, but they are not the only ones who have responded to the call. And as Manitobans now know, we've been asking for help from Manitoba businesses and industries and retailers. And Manitoba business, industry, and retailers have been stepping up, thanks to the creation of a $100 million purchasing fund that we announced on Friday, and our online portal, which is designed to help local businesses interface with government to register those supplies and services that they could offer in our response to this health pandemic. Their help is ensuring that frontline healthcare workers have the specialized equipment that they need to protect themselves and to protect patients. On the topic of our frontline workers, I can also update you on our directive under the Regulated Health Professions Act, where we asked former registered nurses to re-enter the workforce in light of this epidemic. And as of yesterday, I can say that 7 applications have already been processed and approved from former nurses for temporary registration with no cost to themselves to come back into the workforce. So thank you. There are 26 more open applications that are being scrutinized. We have a lot more applications besides that. Some are not eligible for certain reasons, but we continue to put that call out for former nurses. Now is the time we're asking for you to come back into the workforce. We're proud of how all Manitobans have stepped up to contribute, and there is a way for you to help our researchers in the COVID-19 clinical trial. So we're asking Manitobans who meet the study's criteria to consider joining this trial to help us scientifically prove the benefits for Manitobans and for people all around the world. Nous demandons aux Manitobains qui répondent aux critères de l'étude d'envisager de participer à cet essai afin de nous aider à prouver scientifiquement les avantages pour les Manitobains et les gens partout dans le monde. Tracey and Dr. Zarychanski will have more information on that in just a moment. In closing, we've learned a great deal about this virus that we did not know even a few months ago. However, as we all know, there are many more questions to be answered, and these investments that we are announcing today will help contribute to the world's understanding of the virus and make important strides towards vaccines, treatments, and possible changes to how our healthcare system operates to better combat COVID-19. At this time, I want to turn the microphone over to Tracey Maconachie, who will speak to us as the chair of Research Manitoba. Tracey, please.
Thank you, Minister Friesen. Thank you for having me here today, and thank you to all Manitobans for everything that you are doing to stay safe and to flatten the curve. As the COVID-19 pandemic continues to challenge health and well-being of citizens and healthcare systems around the world, we realize that the key is research. Research to help us better understand the virus, how it spreads, and how to assist patients. Research will provide us with the tools and insights to combat COVID-19. Established in 2014, Research Manitoba has been working to promote, coordinate, and support research in Manitoba. We know that Manitoba researchers and companies are well positioned to participate and lead in studies that will test treatments, vaccines, and diagnostic tools, as well as evaluate public health strategies. So it is our hope that through the creation of the COVID-19 Research Fund, we are able to support these teams to be on the forefront of the fight against COVID-19. These are unprecedented times, and through this fund, we are taking the necessary steps to ensure that the researchers are connected to the provincial incident command structure so that the results of these studies and any new tools that are developed can be applied quickly, benefiting a large number of citizens both in Manitoba and around the world. As Minister Friesen noted, Research Manitoba's COVID Fund has $3.5 million. These dollars are available for rapid response research to support clinical trials with patients, as well as applied research related to COVID-19. We know this is a priority for all Manitobans. Applications to this program are welcome from Manitoba-based researchers who are leading or participating in national and international studies. Another portion of the funds that we are announcing today is $1 million to support research within local companies, those who are developing new products and new technologies to help with the fight against COVID-19, and to support the long-term job creation here in Manitoba. We have already heard and seen of Manitoba businesses rising to the challenge and developing new solutions. We look forward to hearing more about their work. Research Manitoba will quickly be opening to accept and review projects, ensuring that researchers can start their studies as quickly as possible and companies can begin their work. We recognize that time is of the essence. Additionally, we have $500,000 With that, we are looking for opportunities to work with partners to support this work in Manitoba and across Canada so that we can bring more studies to Manitoba looking at treatment as well as vaccines. For more information about Research Manitoba and the COVID-19 Fund, please visit our website, www.researchmanitoba.ca. Thank you for all of the work that you are doing. Thank you to the Minister, his team, and all of our healthcare workers. We appreciate all that you do.
Thank you, Tracey. At this point in time, I want to invite Dr. Zarychanski to make some comments. For those of you watching at home, Dr. Zarychanski, as we said, is joining us by a telephone link. So, Dr. Zarychanski, over to you.
Thank you, Mr. Friesen. I do want to thank the government for this very generous contribution. This government gets it. They get that good clinical care is synonymous with its scientific investment. How will we know what treatments to give patients in Manitoba without studying them? How will we know where to put our investment without understanding the returns that we might get from it? This research fund that's been created today will fund shovel-ready teams, leverage our expertise locally to collaborate nationally, internationally, to launch several clinical trials of several experimental medications, some of which we hope will reduce severity of disease and mortality in people affected by COVID-19. The money provided will also, and very excitingly, at the request of international communities, scale up locally developed treatment protocols that the world wants to participate in now. Manitoba is going to show that they can participate globally as a team member, but lead also globally as a research leader.
Thank you, Dr. Zarychanski. Again, for those of you who might be just joining us, Dr. Zarychanski is an associate professor of internal medicine at the Max Rady College of Medicine, University of Manitoba. And of course, thanks again to Tracey Maconachie, who is the chair of Research Manitoba. At this point in time, we'll take questions.
Thank you, Minister. A reminder to the reporters online, they will get a primary question and one follow-up. Up first, Danielle from the Free Press.
Thank you. Danielle De Silva here from the Winnipeg Free Press. Just on the topic of this funding, how long until researchers can see that money, and what kind of application period are you anticipating? How long before these projects can get going?
So we recognize that time is of the essence. This research needs to be done quickly. Some of it may have already begun. So going to the Research Manitoba page, you will see an application process within the next 7 days, and we will begin to review and evaluate those. We will be moving as quickly as possible, keeping in mind good science.
From Global, Kevin.
They're just wondering about an update on the hydroxychloroquine trial. How many people have volunteered so far, and when do you expect to see some results on that?
Yeah, for sure. This is one of the 6 trials that we are launching, but it's the one that's enrolling right now for positive patients and for household contacts with positive patients and for healthcare workers with high-risk exposures. We are running this in the United States and in many parts of Canada. Manitoba is a leader in this trial in Canada. So far, we have about, I think, 500 patients enrolled, a few dozen from Manitoba, and many from Quebec also. I would like to say, though, for patients who are positive, if you live with someone who's positive or are a healthcare worker with high-risk exposure, do think about participating in the trial, and we will welcome your involvement to understand that this drug is useful and whether we should be using it in everybody.
Okay, and I guess just my follow-up, the drug itself, what is the hope that it does? It's not a cure, it's not a vaccine from what I'm reading, but what do you hope it does if everything works out here and the research is done and everything works out?
Yeah, so again, we're studying several drugs in early disease, moderate disease, and severe disease. myself and a whole team of people have organized probably about 5 or 6 different therapies that we're studying nationally and internationally. Hydroxychloroquine is one of them. It's gotten a lot of press because of a little bit of decrees that have occurred south of the border, but we do not know if these drugs are effective, if they're worth our investment, and if they're safe to give in everyone. We have joined forces with a large international team to study its effects in early disease. Results should be available within the next few weeks.
From the Brandon Sun, Kyle.
Hi, this is Kyle Darvis from the Brandon Sun. I was just wondering, the people who can volunteer for these clinical trials, is that mostly relegated to people who have tested positive for COVID-19, healthcare workers and the like, or do other people qualify for that?
Yeah, no, that's a great question. It's been a goal of our research team to ensure that Manitobans at any stage of the disease have access to a potentially beneficial medication within the context of a well-designed trial. That's our goal. And so some of the trials we have launched and are launching are in really early disease to prevent anyone from getting sick, like healthcare workers, and that trial is coming in the next couple of weeks, to early disease in people who are positive but not in hospital, and that's the one we have launched right now. We'll be studying 4 different drugs as therapeutic options to patients enrolled in the hospital setting, and then another set of drugs, some of them overlap, for patients who are critically ill on life support in our intensive care unit. So regardless of the severity of disease, we have protocols in place to study drugs that may be beneficial at the whole spectrum.
Thank you.
Yeah, you're welcome.
From the Winnipeg Sun, James.
Yeah, thank you. There's been a lot of footage from other jurisdictions and around the world of spraying a lot of, or just the sanitization in the streets. And I'm just wondering if this is something that's up for consideration in Manitoba.
So I'll answer that. We have seen in other jurisdictions internationally the use of some substances to be able to, as you say, disinfect large public spaces. We know that there's a lot of planning behind the scenes here in Manitoba. We are just at the tip of the iceberg where we're starting to see that consistent community spread. And so at this point in time, while their plans continue behind the scenes for many things, you are not about to see that kind of thing. However, at the same time, I would point out that there are very significant additional cleaning methods that are being taken up not only in healthcare centers and hospitals, but even by businesses and others, and Manitobans have become aware of the many efforts undertaken to sterilize and disinfect surfaces. And of course, always the reminder back to Manitobans is the most principal form of protection you can take is to wash your hands often, cough or sneeze into your sleeve, and to stay at home as much as possible.
Thank you.
From CBC Radio Canada, Leza. CBC Radio Canada. From CBC Manitoba, Nicholas.
Hi there, CBC Manitoba. Oh, wow, there's an echo, sorry. I apologize if I missed this earlier, but when might these clinical trials, when are they set to start?
Maybe Ryan could take that?
Yeah, for sure. So clinical trials typically take 1 to 2 years to get off the ground. Our first clinical trial we had submitted to Health Canada, the University of Manitoba Ethics Board, contract signed, patients enrolled within 6 days. So it is clinical science on fire right now. We are bringing science to the bedside as physicians. We're incorporating patients into trials quickly so we can understand what works. That's our first trial. The second one should be open in about 1 more week, and in the next 2 to 3 weeks, we'll have probably about 5 launched within the province of Manitoba.
Okay, thank you. And just a quick follow-up. I mean, Once these trials are done and you get your results, how long is it usually until we would see a vaccine?
Yeah, so the clinical trials we're doing are drug therapies at the moment. We will hopefully, our intention is to see results within weeks to months. Okay, so the idea is to do these trials as quick as possible, as collaboratively as possible with people around the world, so that the trial can get started and finished with an answer that could inform this current pandemic. And a vaccine, it will take probably another year or more to develop, is what our vaccine experts are telling us. And until that point, there is at the moment no proven therapies specific to COVID-19. And so thus the urgency for the need for very practical clinical trials, shovel-ready projects with large teams, so we can develop an interim therapy that could reduce mortality before a vaccine, which is our ultimate hope, is available.
Thanks so much.
From CTV Winnipeg, Michelle.
Hi, it's Michelle Gerwing from CTV Winnipeg. I'm just wondering, how do you know which drugs that are already on the market are the ones that we should be testing? How do you narrow that down?
Yeah, I mean, there could be a complicated answer to that question for each specific drug. But in the case of hydroxychloroquine, some of the initial laboratory data were from the SARS epidemic, that occurred, in the early 2000s, where there was some initial research that showed that the agent could reduce viral replication at that time. And there's been a couple of laboratory studies since then. With regard to the heparin treatment that I lead, and it's a trial that we're scaling up around the world, this agent is something that is around. We use it throughout the hospitals each day. But there's some really exciting data showing that this drug, this blood thinner that we use every day, actually interferes with the adhesion protein on the virus that is needed to enter a person's body. And so a drug that is really inexpensive, already available, seems to reduce the ability of the virus to enter the body and reduce blood clots and inflammation, is a wonderful idea. And therefore, we just wanted to repurpose it. And so it's, the answer is based on some laboratory data, some initial studies in humans. We leverage that information, come together as a community, a scientific, a clinical community, to start a trial, then to find out the answer whether this really works or not. What we can't do is rely on the early data that fuels the enthusiasm, and that's created some of the emotion and hype around the world, where there's initial report from here, initial report there, some interesting facts here, but all that is anecdote and testimony, and that's not a replacement for good clinical trials. And that's what this money in Manitoba will allow us to conduct. So we'll get the right answer to give the right treatments to the people in Manitoba and beyond.
All right, we have time for a few more questions. Anyone have another question for our speakers today?
Yes, Danielle from the Free Press. I was just wondering, Tracey Maconachie, if you mentioned how some of this research could be connected to the province's incident command center. Can you explain what that might look like in practice and
Certainly. I can
how that could be implemented in the future?
Yeah.
Oh, sorry.
That's okay. So when building these trials and these studies and building in the funding models for it, we'll be putting in early milestones that ensure that there's a connection and a reporting. Often with clinical trials, because there are longer timelines, these only happen every 3 to 6 months. Instead, in this situation, we're actually going to have the researchers reporting back in a much more timely fashion. In some cases, that'll be weekly. In some cases, it'll be monthly. So we'll be ensuring that there's that stronger connection between the research that's happening and the command team.
Thank you.
It's Michelle from CTV. This is unrelated. Just also for Cameron Friesen, just wondering about if you've heard from the Easter Bunny and whether he's coming.
Well, as we said yesterday, the Easter Bunny has been added to the list of essential workers so that the Easter Bunny can carry on the important work. But I did also caution children this year that as they will be looking for Easter eggs, my hint would be to start looking for those eggs at least a minimum of 2 meters apart, because if the Easter Bunny is paying attention to Dr. Roosen's daily updates, that will be important, and also that Easter Bunny must make sure to be washing the bunny's paws frequently throughout that effort. So that's my update on that.
Thank you.
Any other questions? Well, that concludes today's media briefing. Thank you.